Hi there. Today we're going to talk about something that seems like common sense, but some people need a little guidance. If I'm boring to you, go back and watch the one about shingles or something. I'm going to talk about how to make the most out of your doctor's appointment. I have people that come in a lot of the time and it seems like we're kind of spinning our wheels, so hopefully I can help give you a little guidance. Number one, don't only see your doctor when you're sick. I had to get over it a lot of years ago that people don't come see me just to say howdy, but it's a good idea to see your doctor when you're well so that you know what your baseline is. They know who you are and how you act on normal days so that they can contrast that when you are sick. Number two, you are your own advocate, so speak up and talk about the things that you need to talk about while you're there. Number three, make a list. If you have things that you really want to cover in that appointment, make sure that you have those and any questions you might want to ask written down, and that way you'll cover what you need to cover. Let me piggyback on that by saying, don't save up a whole lot of things to go over in one visit, because in most primary care offices, the visit might be scheduled for 15 minutes, but about half of that is spent charting. So if you think that you're going to be able to cover 7 issues or more or whatever with your doctor in 7 minutes, it's too much.
Ain't nobody got time for that.
Also, if you have too many things to cover, your doctor doesn't want to start you on 4 or 5 new medications in one office visit, because if something causes a side effect or doesn't work, you're never going to be able to narrow it down to which one. So it's really best when you go in if you just see them for 1 or 2 things. Sometimes, if I have a patient who has a whole lot of stuff to go over, I tell them, okay, you tell me what is your main concern, and I want to talk about this, usually their blood pressure, that they don't care as much about. And that way you can each have things that you're concerned about that you're covering, and then maybe you come back in a few weeks and hit more of those issues. It's a process. Don't expect just 1 visit a year. Take notes. As I alluded to earlier, when people leave the doctor's office, they only retain a small percentage of the things that you talked about. Myself included, when I go see somebody, I walk out and think, did we cover that? I don't know. So take notes. It's okay to do that. That helps you keep in writing so you can remember later on also the things that you talked about.
Write that down, write that down!
Don't bury the lead. No hidden agendas here. If you want to talk to your doctor about erectile dysfunction or something private, lead with that. If that's the real reason you're there, a lot of times people wait until the very end of the visit to bring up the thing that they're most concerned about. Your doctor is not going to be shocked or surprised if you want to talk about this. And I find that people do a lot of, well, my wife really wanted me to talk to you about this, and golly gee, and they're looking at their feet and shuffling around, and I know what we're going to talk about, but don't bury the lead. Bring it up early in the visit so that your doctor can really address all your concerns. Don't be afraid to ask questions. Now, there's kind of a fine line here, because sometimes it seems like you're questioning every decision that they're making, which oftentimes people find off-putting. I want people to ask questions if they don't understand what I'm talking about, if they don't understand the disease process or why it's important to talk about blood pressure and manage it. That's what your doctor's there for. If you don't feel like you can ask questions, or if you just don't feel like you have the kind of relationship where you're getting out of that what you need to get out of it, then maybe you should find somebody else. Don't be afraid to ask those questions if you have them. Also, in my last tidbit, and this is something your mama always taught you, be nice when you go to the doctor's office. We understand that we see people when they're not at their best, but there's a big difference between somebody who's sick and mean or sick and nice. People tell me all the time, oh, you're gonna hate to see me, and I say, I'm never gonna hate to see you if you're nice to my staff. There's a lot of negative noise out there and a lot of other things. A little bit of niceness goes a long way.
Everybody love everybody!
So, in my next video, we're going to talk about how to have longer appointments and that more close relationship with your doctor. Stay tuned. Don't forget to like and subscribe.